Now, it is a record fine amounting to 8 million euros. The French Medicines Agency has decided to sanction 11 pharmaceutical companies which did not respect the minimum 4-month stocks for drugs of, quote, major therapeutic interest. The fine is 16 times the amount imposed in 1 year, suggesting the agency is now shifting in its strategy to address medicine shortages. To talk a bit more about that, Julia Seeger, our science editor, is with me. And Julia, it seems the Medicines Agency in France really putting its foot down here.
Definitely, and the reason why is because the situation is getting worse. In 2023, the French Medicines Agency received more than 5,000 reports of stock shortages. That's double that of 2021, and it's 6 times more than in 2018. Now, the sanction actually follows a control campaign that was launched in 2023 in several pharmaceutical companies to check the safety stocks of specific drugs that we call, indeed, drugs of major therapeutic interest. What that means is, well, if those drugs are interrupted, they're life-threatening for patients. So that includes, of course, cardiovascular drugs, but also nervous system drugs and anti-cancerous drugs. And following, of course, this audit, they observed failings, which led them to impose these sanctions. Now, just as a reminder, 3 years ago, actually, in 2021, the law was toughened in France, forcing labs to respect a 4-month safety stock for those drugs of major therapeutic interest if they had experienced somewhat of a shortage in the last 2 years, and a 2-month safety stock for all other drugs.
And look, 8 million euros, this is a historic fine, Julia. It looks like the French Medicines Agency toughening its approach to try and really address this shortage.
That's right. Until now, the agency didn't really use its financial sanctioning power. If you just take a look at 2020, which of course was in the midst of the COVID-19 crisis, we experienced several shortages. Well, there was only, I think, 2 sanctions that were issued against a drug manufacturer. 2022, 2023, there were about 6 sanctions that were slapped on pharmaceutical companies, but it only amounted to 500,000 euros. So, you know, it's really not that much, actually. If you look at this fine, it's 16 times more than what was done last year, but it's among 11 pharmaceutical companies. So I'm not sure that that amount will hurt them in any way. But as you said, it is a sign that the agency is shifting its strategy, but also toughening its stance.
And look, viewers who are in France or who have visited may well have actually noticed these medicine shortages themselves. These are on things like antibiotics, but also even paracetamol.
That's
Just
right.
tell us, I mean, why are we seeing these shortages?
Well, we actually see them in France, and we may feel like this is a very French thing, but it's actually a global problem. And one of the reasons why is because of the relocation of pharmaceutical production to countries with low labor costs. So you have 80% of active drug ingredients today that are produced outside of Europe, mainly in Asia, in India, and China, compared to about 20% 30 years ago. The other problem is that this production is concentrated in the hands of just a few players, of just a few pharmaceutical companies. And the last element, which is very important, is the financialization of this sector. The investment funds, especially in the United States, have become shareholders of those big pharmaceutical companies, and hence they have a significant weight in the strategy. Their focus is on maximum profitability. So now it's more interesting for pharmaceutical companies to sell what we call innovative drugs, so drugs that are more profitable, than to sell, for instance, generics who we know are less profitable because their patents are often free. So generally speaking, they put all of their weight, all of their production on these innovative drugs to the detriment of those other drugs that we've been using for a long time, that are more mainstream, let's say, but are vital for many patients. The consequences of stock shortages are terrifying for patients. Of course, it's very complicated for hospitals, pharmacies, but also doctors who have to find often less effective alternatives.
Julia Seeger, our science editor. Thank you.